Okay, so my assignment is proprioception of a medial ankle injury. I want to talk about just kind of the time frame. For a mild medial ankle injury, we're looking at maybe about 1 to 3 weeks of recovery. Or something a little bit more moderate, we're looking at maybe possibly 3 to 4 weeks. For something a little bit more severe, we're looking for possibly 3 to 6 months, and that's just because, again, there's going to be very limited blood flow to the ligaments. In terms of our goals for short term, making sure that we can do the exercises, achieve that range of motion, being able to do the exercises without pain, without swelling, would allow us to go into the next phase, would be to get it to be strong enough to go into that sport-specific activity for the individual. So the first exercise that we're going to do is going to just be us getting a mat and taking the TheraBand. And what we want to do is we want to make sure that we have our leg isolated so that we're not using our hip when we're actually conducting the exercise. Band around the top of our foot, and we want somewhat of a dorsiflexion as much as we can, position of the ankle. We want to make sure that we pull outward. So again, we want to do kind of a dorsiflexion, pull or flex, and then we want to pull in. So the next exercise that we're going to do is we're going to get a Bosu ball like this, and just with our own weight, our own body weight, and with obviously gravity, we want to step on the Bosu ball with one foot. You can work your way into lifting your leg and reaching that point where you have mastered this phase. The next exercise is using the same Bosu ball. Until you get to a point where you're strong enough to be able to do several reps. If they're able to sustain a full practice of their sport, they should be able to go into the next phase, which is going back to their sport-specific activity. And that's it.